Hi, I'm Dr. Michael Alvarez. Are you having issues with snoring and sleep apnea? Learn how your dentist can be the best source of help for your sleep disorder issues. In this video, we're going to discuss how I design a custom oral appliance. I will also discuss with patient Wayne our totally unique daytime appliance.
Okay, Doc, now that we did all this, what's going on now? I'm getting a little bit confused. Help me out, remind me what's going to be happening now.
Okay, now that we have taken your impressions, we've done the range of motion measurement and bite registration, we can now construct the custom-made oral appliances just for you and for your problem. You know, you answered all these questions in my questionnaire for snoring. You've done the Epworth sleepiness scale. You have done some special questions I have for people who have sleep and breathing problems. You've answered these questions for me. We've done the oral examination. We have done the review of the sleep studies. You signed the informed consent of using oral appliances for treating sleep disordered breathing. Now I get to design oral appliances just for you. There are two main kinds of oral devices we use. One at night is for bringing the tongue forward, literally bringing it forward. They're called tongue retaining devices. The other is mandibular advancement devices. They're the ones that bring the lower jaw forward. Both are getting at the culprit, the tongue, repositioning of tongue. One is a direct reposition, tongue retaining, and the other is indirect, bringing the lower jaw forward and guiding the tongue forward with unique designs we place in our plastic retainers. What we also will look at is making you daytime appliances.
What?
This is brand new.
What?
You won't get this any other place, any other office. We are establishing that people who have sleep disordered breathing also wake up with the same throat, go throughout the day with this throat that we have already diagnosed having a breathing problem, a small airway. We're going to help improve your breathing even during the day.
Is that how come sometimes I just feel tired in the daytime? Is this what you're trying to tell me?
When you get fatigued and stress is overtaking you, or you're getting overwhelmed, or you're getting on edge feelings, that is a sign and symptom of daytime breathing problems. I call it day apnea symptom sets. By wearing the oral device, we're going to help you breathe better during the day, so when you go to bed at night, you'll be able to put the appliance on and you already have trained your tongue to accept this nighttime appliance, and you'll do even better at night because we've helped you during the day breathe better.
Well, how long have you been investigating this daytime stuff?
I started in 1977 doing TMJ therapy, and what I did was I usually made the TMJ appliances, these splints, nighttime splints that you just wore at night. But then I had patients who had daytime pain. So we not only use them at night, we started using them during the day. And what happened was when people started getting auras of a headache coming on, they would put the TMJ splint in their mouth, and what happened? Their symptoms went away. They didn't have to wear it 24/7. No, they would put it on when they started feeling some of the signs and symptoms of TMJ dysfunction. And lo and behold, TMJ symptom sets are now part of the sign and symptoms of sleep disordered breathing. So we put it together. We can now help people breathe better by wearing a daytime appliance. And we have gone through all different designs of daytime appliances. Now we have the most comfortable, the most user-friendly oral appliance ever designed for daytime use. It's called the P3 appliance, Personal Power and Performance. It's a mouthpiece you can wear during the day. You can talk with it. You can drink any liquids with it on, and no one can tell. It is the smallest device, usually made for the bottom jaw. We'll make it for you. Every patient that comes to see me will have the option of getting a daytime appliance as part of the complete therapy. You won't get this any other place. We look at you 24/7, not just at night. Yes, we'll help you with your sleep disorder breathing, but we're going to help you with something that contributes to the sleep disorder breathing. That's day apnea symptom sets.
Is this part of the whole therapy price? I mean, that way you don't have to do a separate billing, to my insurance company?
I include the daytime therapy in my treatment plan for you. Yes,
Okay.
it is included.
Okay.
That's what makes me unique in my work, is that I offer a complete treatment for you. You'll be able to experience the daytime appliance. You don't have to wear it all the time. You can test it. I usually tell my patients, do you do any athletics? Do you exercise? Do you run? Do you do marathons? Are you a bicyclist? Are you a baseball player? I want you to wear this when you're working out at the gym and see what the difference is by wearing it compared to not having it. You're going to realize you increase your strength, your endurance, you reduce stress loads when you're exercising. Now, if you're not an exerciser, you're not an athlete, but you're sitting in front of a computer and you're starting to get really sleepy, you're starting to get fatigued, your shoulders starting to ache, you're starting to get a headache, put it in then. Usually in the afternoon is the best time to place it in. Okay, when's another high stress? When you're driving, when you're commuting. Put it in when you get in the car and when you're driving after work. You're going to see how much better you'll feel that you're able to breathe better and get that extra oxygen. I hope that you enjoyed the video. It is my sincere desire to help anyone with sleep disorder issues. My office has helped people all over the San Francisco Bay Area. Please contact me now if you are suffering with any sleep disorder issues or just plain want to stop snoring.
Please contact the office of Dr. Michael Alvarez at 510-470-7972 or on the web at www.stopsnoringsleepingdisorders.com. Don't suffer any longer. Contact us now at 510-470-7972 or on the web at www.stopsnoringsleepingdisorders.com.